Introduction to Evidence-Based Medicine and Evidence-Based Medicine Resources by Iman Abdulraouf Mohammed, Professor of Pediatrics and Pediatric Hematology, Faculty of Medicine, Cairo University. The objective of these presentations are to know why evidence-based medicine is important, to learn about evidence-based medicine using real-life clinical scenario, to outline the steps required to practice evidence-based medicine, and to compare the most important EBM resources. We will work through the presentation through seeing a common pediatric clinical scenario, checking the most common ways of practice that we are currently in use by many physicians, to compare it with the evidence-based medicine approach to practice. We will check on important EBM resources available for you, and we will compare between different resources, and finally we will reach a resolution to our scenario. Our patient is Sarah. She's 5 years old, healthy girl, presented to your office with 1 day history of fever and severe ear pain. She looked well and physical examination was irrelevant apart from bilateral red congested eardrums, and your diagnosis was acute bilateral otitis media. After examination, you were about to write a prescription with an antibiotic and a painkiller. However, her mother interrupted you and asked, "My daughter has been on antibiotics several times this winter, and I am worried about her and about the repeated use of antibiotics. Shall we treat her without the prescription of antibiotic, doctor? Is that possible?" You pause to think about the mother question and to find an appropriate reply. For the time being, you felt it's quite risky not to give an antibiotic for the child with bilateral acute otitis media. You communicated your concern to the mother and wrote an antibiotic prescription. In the meantime, you promised yourself that you will check updated evidence in otitis media soon, because it has been a while since you read the guideline about the disease. Back at your office, you were thinking again about the otitis media patient and the mother question. You know from your experience that there are different approaches for the management of the same disease, otitis media. Some of the approaches are well referenced and has roots in textbooks and scientific research. Others are based on false beliefs and dangerous practices. Your aim is to integrate your experience with recent evidence and to provide your patient with the best possible care. You remembered that during your training in evidence-based medicine, the instructor compared two approaches for decision making in clinical practice. The first approach is the traditional approach, which is used by many physicians to seek and know the answers for problems they face in their daily practice. In that approach, physicians depend on their own experience, which they have developed over the years of practice. They might also consult senior colleagues or experts to seek their opinion in difficult or rare cases. Lastly, if they didn't find their answer with colleagues or seniors, they go to the textbooks and medical journals to find them. Here are the limitations of the traditional approach for medical practice. First, clinical experience alone is limited by the width and the breadth of your practice. If you work in primary care, you will have a completely different experience from physicians working in secondary and tertiary care. This is because the type and number of patients you see are different. In addition, resources available for management in primary care are different from those available in referral settings. As for experts, they are excellent resource for information and in-depth experience. However, they might not be updated regularly in a specific topic. They are also constrained by the cases they see and the type of practice they are in. Expert advice is an excellent source for decision making, provided it is updated and linked to trustable sources of research evidence. As for textbooks, they represent convenient references for information and knowledge about a specific disease. However, they are usually 3 to 4 years older than recent clinical research, which is published regularly online, in medical journals, and in Medline databases. In addition, they represent, textbooks, the views and experience of authors who wrote them, and they are not based on a systematic approach for searching, evaluating, and summarizing informations. The evidence based medicine approach, in comparison, is dependent on the following points, or on the integration of the following three elements: research evidence, which is published in medical journals on continuous basis; clinical experience accumulated through your work with different patients; the patient values and preferences, which change with different patients and different cultures, and it should always be accounted on during the process of decision making. To practice evidence based medicine, you need to go through the following steps. 1. You will ask appropriate clinical question, and we will learn together how to formulate a clinical question. 2. You will acquire the best evidence through searching in evidence-based medicine trustable resources. 3. You will assess the acquired evidence for applicability in your own situation and with your own patients. 4th, you will apply the evidence appropriately while making sure that your patient understands their choices and appreciate the limitations and benefits of various treatment options. In evidence-based medicine, physicians formulate a well-structured clinical question. They will search appropriately the relevant databases. They will evaluate the evidence for applicability in their own situation, and they will apply the evidence where appropriate after discussion with their patients and after integrating their patient values and preferences in the final decision. First, let's start by the basic. The basic is the definition of evidence-based medicine. According to David Sackett, evidence-based medicine is the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of individual patients. So, you decided to adapt the evidence-based medicine approach. And for that, you go into the first step, which is ask a well-structured, meaningful clinical question. These questions include the following points. Who is my patient? What is her diagnosis? Her age? Our patient is a female. She's having acute otitis media, and her age is about 5 years. The second question is, what is the intervention I am aiming for or comparing? What is the intervention I am asking about in that situation? In our case, it is antibiotics. The third part of your question, what is my comparative intervention? What is my comparative intervention? In our situation, we are comparing not giving antibiotics, only painkillers. And what is the outcome I am aiming for? This is the final part of your question. And in that case, our final outcome is cure of the patient from acute otitis media. Here is our well-formulated clinical question in PICO format. Patient, acute otitis media, intervention, antibiotic, comparative intervention, placebo, or just giving painkiller, and the outcome of interest is cure. This is the PICO format: patient, intervention, comparison, outcome, that is used for constructing well-formulated clinical questions in evidence-based medicine. Okay, you formulated a well-structured clinical question. Now it is time to extract your search terms. After formulating a focused clinical question, you started preparing to conduct an effective search. For that, you need to do the following. You need to extract appropriate search terms from your question. This might include the diagnosis, the treatment you want to compare, the outcome of the treatment. Sometimes it is also helpful to include the age range of your target patients. If we applied this to our scenario, the appropriate search terms would be the following: acute otitis media, antibiotics, cure, and the age range we are seeking is children. Please notice that you are not required to use all the extracted search terms. Actually, you can start with the diagnosis, then add search terms if you find the results in different databases either irrelevant or too much to be browsed. So in our case, we will start with the term acute otitis media, then we will add more terms according to the results of the essential search. Where we are going to go in medical literatures. There is a hierarchy for evidence-based medicine resources that should be followed by physicians when they search for an answer to their formulated questions. The hierarchy is presented in the slide graph as a pyramid. First, physicians, if possible, should consult clinical decision support systems. They are electronic, continuously updated databases that are linked to electronic patient records. Results from clinical decision support systems are recent, of high scientific quality, and is entirely customizable to the patient at hand. Unfortunately, they are not available in many institutes, and most physicians cannot access them through internet services or subscription. So, if we didn't find clinical decision support system, where to go? Physicians should go to what we call synthesized evidence-based medicine resources. It is databases where critical evaluation of research have been done, like critically appraised topics and practice guidelines. These resources are constructed through a comprehensive methodology that ensure adequate search and evaluation of relevant references. Examples of synthesized high-quality secondary sources is British Medical Journal Best Practice, up-to-date database, and the Guidelines section at Clinical Keys and Guideline Central website. The Guidelines section at Clinical Keys and Guideline Central websites are available for free in our country, so you can use them to find well-formulated and synthesized evidence ready to use for your patient. Okay, if you didn't find a guideline or a synthesized evidence-based topic for your patient, then you should seek the answer in other types of databases like systematic reviews in the Cochrane Library. Cochrane Library articles are well-evaluated research articles collecting data across various research papers to answer one clinical question, and they are available also for free, so you can use them to find an answer for your clinical question. If no answer is available at the Cochrane Library, you might think about clinical meta search engines that has evidence-based medicine filters. For example, the Triple Database or SumSearch. Lastly, you might consult the midline like PubMed through using appropriate search filters in order to obtain summaries of high-quality research studies. I must mention that there will remain many questions where doctors will not find an answer in trustable online databases and research. And in that situation, they must rely on consensus of experts in the field together with their own previous experience about similar cases. Example of evidence-based medicine resources. The Egyptian Knowledge Bank has made available free access to the Cochrane Library of Systematic Reviews and the Clinical Key database. You will need to have a free account at the Egyptian Knowledge Bank in order to access these sources. Clinical Key provides access to high-quality evidence-based guidelines, full textbooks, recent textbooks, and full-text medical journals. Guidelines will be your target to find answers using the evidence-based medicine approach. Other very important evidence-based medicine resources, as I have mentioned, are the British Medical Journal Best Practice and Up to Date. But both of them are available for subscription. You cannot access them for free. However, Guideline Central is a free website that presents guidelines well searched, well referenced. Many of them are constructed using evidence-based methodology that you can use for finding answers to your clinical question. The following table shows example of different type of evidence-based medicine resources, the strength and the limitation of each type. Secondary evidence-based medicine resources like British Medical Journal Best Practice and Up to Date are continuously updated, patient-oriented, easy to use at the point of care. But they require an expensive subscription, and some are rare and uncommon diseases may not be included in these databases. Guidelines like Clinical Keys Guidelines and Guideline Central are constructed based on strong and systemic methodology, free of charge and don't require subscription. I must remind you that Clinical Keys is free of charge through the Egyptian Knowledge Bank. May not be continuously updated. Guidelines, that's true. Guidelines are constructed every few years. Many diseases doesn't have guidelines for their management. Third is systematic reviews, the Cochrane Library. Constructed based on strong and systemic methodology, free of charge and don't require subscription, but they are narrow in focus and doesn't cover all questions that clinicians face. For example, you will find a systematic review that answers only a question about the use of antibiotic. Another one will answer a question about the use of decongestant in acute otitis media. A third one will be speaking about tympanometry in otitis media. But you will not cover a systematic review. You will not find a systematic review that cover all questions about management of pediatric patients with acute otitis media. But you will find guidelines in that domain. Meta search engines like Trip Database and SumSearch, they use evidence-based medicine filters and they are free to use. But their limitations are results are not always appraised, and many primary research studies that needs appraisal are included in the results. So, what you are going to do? Returning to the opening scenario, you remember your patient has bilateral, acute, and painful ear inflammation. You have found that recent evidence-based medicine guidelines present in Guideline Central and in clinical keys recommend the early use of appropriate antibiotics in bilateral acute otitis media for fear of the disease complications. Actually, you have prescribed already antibiotics for your patient. So, what is the change? The change is reviewing the evidence made you confident in your decision making, and it will be reflected on the management of many similar patients in your practice. It will be very important in your further communications with the parents who will ask you if it is needed to give an antibiotic in that situation or not. Okay? So to summarize, at the final slide of our presentation, evidence-based medicine is the integration of high-quality research evidence with the doctor experience and patient values. It requires 5 steps for its application. Ask clinical question, acquire the best evidence, assess the evidence for applicability in your own situation, and apply the evidence judiciously after discussing the options with your patient. There are several accessible and trustable evidence-based medicine resources that physicians can access and search to find answers for their clinical questions. Thank you very much for your time, and I wish you the best in your practice.